So initially, when we meet with a patient that's been struggling with their fertility, we order a series of tests after we take a history and physical. There's several tests that really outline the various categories where there may be a problem. And they're not, it's simple. There's usually about three. There's an X-ray that looks at the anatomy of the uterus and the fallopian tubes. There is a test to look at sperm count and how those sperms swim. These are things that give us some idea about two large areas of fertility. And then the third really has to do with the woman's ovulation and one's egg reserve, and a lot to do with where she is age-wise and how that may relate to her fertility. That evaluation is performed with blood tests and an ultrasound. An ultrasound scans the ovary, and one can actually count the numbers of resting eggs or follicles in the ovary, and is a very good indicator of one's fertility potential. The other is a blood test, a new test today called anti-Müllerian hormone, AMH. Again, a test that tells you about the reserve of eggs in the ovary, which is very important in terms of a woman's fertility potential and possibly how to treat that. There are several other tests for hormones, for thyroid and prolactin, but the three main tests are the ones we focus on initially and help you get an idea about the plan of action to move forward in terms of potential treatments.